Okay, I'm going to get started now. So the session today is on preparing for your medical school interviews. So as a lot of you mentioned, you would have just submitted your UCAS application last week, and you're probably waiting on hearing back about interviews and whether you have been offered an interview or not. So yeah, I can understand it's probably a really stressful time for a lot of you, but just make sure to focus on your A levels, and then have, obviously think about things like interviews on the side as well, but don't put too much pressure on yourself. So that's the main advice I can give. If you're not hearing from the unis soon enough, it might just be that they're taking a while to go through all the applications. So don't put a lot of pressure on yourself in terms of interviews and things like that. So if I just move on to the next slide. So before we get on to what we're going to cover today, just a few things about the company itself. So SIXMED is a company which is created by medical students for other medical students. And we basically do lots of different teaching to help people get into medical school. In the last 6 years, we've taught over 10,000 students, and the kind of events we run are these surgery webinars like the ones you're attending today. And that's usually every Sunday, 2 to 3 p.m. And you'll probably see me quite often for the next few weeks because I'm running a few of them. But you'll also see some of my colleagues like Ella and Martin. You might have heard of their names as well, if you attended previous surgeries. We also do things like UCAT and BMAT support. Now, this can be one-to-one support, or it can be support through like these large course interviews, which we do during the day. Most of the UCAT ones are now finished, and so the BMAT ones, because they were done in early August, July, August, and then October and September as well, before your exams. And then we have obviously personal statement support. This will probably be more relevant for people who are currently in year 12, but just for reference, if you know anyone, you can refer them to it as well. And then finally, right now we're doing interview preparation. So our first course begins next Saturday, if that's something you're interested in attending. So a little bit about me. I'm a fourth year medical student at Bristol University. I just finished my intercalation last year at Imperial, and I'm quite passionate about teaching, which is why I do these sorts of things, and I'm quite interested in surgery in the future. So the main agenda for today is to just introduce you guys to medical school interviews, what they are, what to expect from them. And then we're going to go through the different types of interviews that you may come across. So some universities like to do interviews in, just 3 or 4 of them asking you questions for 30 minutes, or some of them like to do mini stations, so multiple mini interviews where you have lots of different interviewers, and at each station they test a different skill. So we'll go through both types. Or they might ask you to do group interviews where you're basically in a group of other candidates and you all have to work together to solve a task. And then we'll go through what the common topics are that come up in interviews. If you get these common topics in your head really well, and if you're able to answer these questions really well, then pretty much about 60% of that interview you've got down and you're able to basically answer them. So that's why I always think it's important to focus on these common topics, because they're asked in all the medical schools. So if you practice it from early on, you'll be very familiar with the types of questions they ask you. And then finally, we'll do a little Q&A for anyone who has any questions about anything interview related, or if you want to ask something specific about Bristol Medical School or Imperial, I'm happy to answer that as well. So just a bit of housekeeping. Make sure your mics are muted. I think all of you have your mics muted already, which is good, just to avoid any disruptions. And I try to make the session as interactive as possible. So when I do ask questions, if you guys can type the answers in the chat box function, and then you can post your questions in the Q&A function during the session, and I'll address them as I go. So first question, so on a scale of 1 to 4, how confident do you guys feel about interviews? So 1 being not confident at all and 4 being extremely confident. So where do you guys sit on that line? I'll just give you 30 seconds to answer that question. Fine. So we have a mix of answers, most people being 1 to 2 or 2 to 3s. So on the lower end, which is absolutely fine because you may not have done any interviews before, you may not really know how medical interviews work. So it's probably good to be at a 1 or 2 now, because we can then, by the end of the session, hopefully more of you will be near the 3s and 4s once we finish this. And that's why you guys are here. So please don't worry if you are on the lower end, because we can, that's the main reason you're here. We'll try and improve that knowledge over the course of the afternoon. So my main aims that I want to try and get across to you guys is to understand the different types of medical school interviews and learn about common topics assessed in the interview, because as I said, if we drill that down early on, you're more likely to do really well overall in your interviews, because those are the common questions asked in every university. So first of all, what's the purpose of an interview? Basically, what the interviewer wants to find out is they want to know you as a person. They already know that you've got the grades. They already know that you're well-rounded. They know that you're suitable for medicine academically. They just want to know if you're personable enough and if you're the right fit in terms of your personality for a medical career. Because one thing to remember is your medical school interview into medicine is your interview to being an F1, because after you finish your 5 years of medicine, you don't have an interview to get into F1. So this interview is your interview into your career. So it is a difficult interview, but if you get it sort of structured, if you understand the structure, if you're able to perform well under those interview pressures, you're likely to get in. So that's what I'm trying to get across here. They also want to find out if you would be a good future doctor, as I said, and if you would fit in with their medical school and the values of their medical school. So what do interviewers assess? Well, the main thing that they want to see is whether you have a realistic understanding of a medical career, because some people, I think that medicine is quite, a glamorous career, and you're helping people and you're always having a positive outcome, but that's not the case in real life. A lot of the time you're the person who has the difficult conversations with patients and families, so you need to understand the difficulties of being a doctor as well as the good sides of it as well. And then they want to see if you're showing open body language, showing a positive attitude, and showing that you actually want to be there. They want to see that. And the third thing they want to see is whether your personality suits a medical career as well. So that's what they're judging at that medical school interview. So first question, do you guys know what types of interviews there are? I'm guessing because there's loads of year 13s, you might already have researched into this. So let's see if anyone's able to say. Perfect. So I've got lots of MMIs, panels, perfect. MMI, panel, group. Yeah, so good. Yeah, so those are the 3 types. So you've got MMIs, panels, and group interviews as well. Someone said MMI panel interview, whatever it is that Southampton do. So I'm not too sure if Southampton do something different. They might do. If anyone else knows, feel free to post that in the chat. It might be a group interview or something like that, or a group task. So yeah, most of you got the right answer. So it was MMI, panel, and group. So those are the 3 different types. And Southampton do panel and group, I think. Yeah, some of them integrate 2 of them together. So you might have, 7 MMI stations plus 1 group interview as well for 15 minutes. So they might integrate both as well, just to see your teamwork and communication skills in addition to what they've already tested. So as you guys said, you've got traditional panel interviews, you've got multiple mini interviews, and then you've got the group interviews, which some people really hate and some people find a little bit okay. It depends on the individual and like what type of personality you have as well. The formats you can have it in is online, which has been quite common since COVID, but I think most people are moving back to face-to-face interviews, but just make sure to double check the medical school website before you go to your interview, so you know what format it's in. Because online interviews, a lot of people might think it's easier because you're doing it from the comfort of your own home, but it is harder for the interviewers to assess your body language, and they tend to be a lot harsher in terms of their mark scheme with online interviews. So some people, you either have a preference of online or face-to-face. I personally prefer face-to-face because I feel like you can make a better first impression when they can see your body language and see you in person compared to online. And online can also seem a little bit fake because, you know, it's through a computer, so it's difficult to like keep eye contact and things like that. So yeah, I think it's personal preference as well, but I'll teach you techniques for both of them in the coming weeks when we do more surgeries as well, surgery sessions. So just going through traditional interviews first. We've got these are assessed by a panel of 2 to 3 interviewers, maximum 20 to 30 minutes. And these interviewers could be a faculty member, so one of your lecturers, your future lecturers. They could be a clinician, so basically a doctor in hospital, and it could be with a junior doctor or a medical student. So there's different levels. So there's a professor, and then there's one of the doctors, so clinical doctors, and then there could be someone a bit lower down, like a medical student as well, assessing you. And usually it'll be a 4th or 5th year medical student. Usually they're used by Oxbridge, Imperial, UCL uses it, not UCL, sorry, Imperial. They all use panel interviews. And what the interviewers will do is they take turns to ask questions. And these questions range from motivation to study medicine to issues in the NHS. And the main tips I can give you for panel interviews are, even if just one of the interviewers asks you a question, when you're answering that question, make sure you address all of the interviewers, make eye contact with all of them. When you're speaking, speak to all of the interviewers, make them all feel included when you're answering, and be just as prepared as you would for the MMIs. Because I think some people think, oh, I'm not moving around, I don't have to make a first impression with all these other interviewers. It's just 3 interviews in front of me. But you need to be just as prepared in terms of your knowledge and things like that as you would for MMIs. Just think of it in the way as panel interviews, all the questions are just asked by the same interviewers. MMIs, the same questions are just asked by different interviewers with 1 minute break in between. That's the main difference between them. Don't Imperial do MMI? It might have changed this year. In the past, they've done panel. So if they've changed it this year, this presentation might be slightly outdated. So yeah, make sure to just double check which unis do MMI versus panel. So this might have been slightly wrong. Okay. So with MMIs, what we have is lots of different interviewers, around 7 to 10 of them, and you have 5 minutes per station with 1 minute reading time for each question. This is now used by the majority of the universities because they just it has a very similar structure to OSCEs, which are medical school exams when you come to do them. So I think they just prefer doing it that way because it also gives you a chance to make multiple first impressions with different interviewers. And say if you did badly in one station, you can always bring up your score in a different station, which is a little bit harder to do in panel. Say if you make not very great first impression, it could affect the entire interview. The types of questions you can get are current NHS topics, ethics-based questions, motivation for medicine questions, you know, things about your work experience. You could get given a written task, which could be describing an image or, you know, solving certain mathematical problems under a certain amount of time, or you could get given role play stations, which test your communication as well. So it's a vast variety of different things you can get asked. The main tips for this is to keep up to date with current medical events. So right now it would be things like COVID-19, Brexit, which is still having a massive impact on the NHS, you know, governmental changes, the nurses thinking about strikes, all of that sort of stuff will be current topics that they talk about. And then the one thing is make sure you reset after each station. So what I mean by that, say if you did badly in one station, forget about that station and completely reset and start the new station fresh. Don't keep thinking about how you answered the previous station's question, because that will impact on how you perform in the rest of the station. So as soon as you've done a bad station, just forget it, move on. And that's the best way to try and maximize your marks. Right. A few questions. Will we get a recording of this webinar? Yes, we record all our webinars. So if you do miss it, it doesn't matter. How do you prepare for online asynchronous section? I will come back to that question at the end. Just remind me, Alex, at the end to answer that question. Perfect. Let me move on to the next question. Next station, sorry. Now, group interviews, they're usually part of an MMI or a panel interview, as I said before. It tends to assess teamwork and communication skills, and they put a group of 6 to 8 of you together, and you're given a topic to discuss, and you'll be asked to work as a team to discuss that topic or to complete a task. The main tips with group interviews that I think some students tend to forget is you don't always have to be talking, first of all. And you can take on a leadership role, but with that leadership role, you need to allow every member of the team to participate. You can't talk over people. Make sure that if you're a quieter person in general, to chip in with a few thoughts at least to show that you're engaged. And the way to do that is, say, if somebody else has brought in a thought, then you can add to that. You can say, as this person said, I agree with what they said. And also, I want to add this, this, and this. So that also shows your active listening skills plus your teamwork skills. So you need to work together as a team and not see each other as competitors. You need to, that's the one thing with group interviews. You all need to work in a team rather than try and talk over each other. That's the one thing. Make sure you acknowledge other people's ideas. Make sure you summarize what other people have said and then build on that. And that's the main tips I can give you. Which unis use group interviews, that will depend. It changes year by year. I think last year Hull York used a group interview section. You would need to check the individual websites to see if they have a group component. What ways can you impress the interviews? I'll come back to that at the end, and I'll come back to the next question underneath as well at the end. So areas which are assessed in interview. Motivation for medicine, so that will be things like, why do you want to study medicine? Questions on your personal statement. So not all interviewers read your personal statement before you come in, because you have to remember they interview over like 500 candidates, so they can't remember everything from everyone's personal statement. But in panel interviews, they might bring up your personal statement and ask questions based on it. So if you've written something about a book that you've read, make sure you can answer or talk about it in enough depth. If you might have a station or questions on understanding the realities of a doctor, so that will usually be integrated with your work experience questions. They'll ask you, tell me about your work experience, and what they want to see is if you're able to reflect on the realities of a doctor within that question. Skills and hobbies, so what do you do outside of medicine? Or how do you, de-stress? That's the kind of questions they'll ask there. They could ask you ethical scenarios. So when I say ethical scenarios, they could ask you things about euthanasia, contraception in people who are under 16. They could ask you about, an organ transplant, and they'll give you 2 different patients and they'll say, which patient are you going to give this to and why? So those are the kinds of ethical scenarios they could give you. Or they could ask you about Jehovah's Witnesses and blood transfusions. They're very, very common topics. Another one is abortion, which is also a hot topic now, especially after what happened in America and things like that. Current NHS topics, so what's going on in the NHS, which is an issue, any waiting times, COVID, Brexit, public health campaigns, those sorts of stuff, and striking. They're all very, very current topics at the moment. And then communication and teamwork. So that can be assessed through role play, or it can be, they can give you a situation and they can ask you, can you talk me through how you would deal with this situation? So it's not necessarily role play, but they just want to see your thought process as to how you would deal with that situation. So those are all the variety of questions they can ask you. What are the main topics for group interview? It's usually like a debate question. So they could give you something like euthanasia, for example, and they could say, what are the problems with this? What are the pros? What are the cons with this? And they'd want you to chip in all your ideas. Or they could give you a current NHS problem and they could say, how would you deal with this? And they'd ask you to come up with solutions. So it's or they could give you something like, you need to build a certain thing, and they'd give you like building blocks or something like that, and they'd ask you to work as a team, to work together to see how you're going to build a tower or something like that. It can vary. Do they expect knowledge on NHS from international students? Yes, they do. I think it's definitely good. There's, if you check the NHS, there's a website about which goes through the NHS care plan. If you just type in NHS care plan, and if you type in 10-year NHS plan or any waiting times, all of those topics come in. If you go on 6med, we have a few things about like current NHS topics that you can read on as well. Are group interviews the least common? Yeah, they're not very common, but I think universities that do panel interviews don't really get to test communication skills that much because they don't have a role play station. So I think they will have an additional group interview as well. It varies with unis. It depends on whether they want to do it that year or not. It will vary, so that's why I'm saying like you should check. Nura, is this recorded? Yes, I mentioned before it is recorded. So the standard questions that you'll get asked is, why do you wish to study medicine? They want to test, your what made you initially interested in studying medicine, what motivated you towards this career, basically. And then it's the most common question, so always be prepared for that question because it's easy marks. Another way to get easy marks is knowing this question: why do you want to study at this medical school? So say, for example, you've applied to Bristol and you have got an interview there. They will guaranteed, every single medical school will ask you why you want to study at their medical school. And basically what they're trying to test there is to see if you've read up on the university. So with Bristol, it would be things like they do a lot of clinical contact from the first week of medical school. And if that's something you're really interested in, that might be one of the reasons why you want to go to Bristol. Another one could be you like the hospitals that you could be placed at in third year, fourth year, fifth year, things like that. So you need to research the university that you're applying to. Another easy question is, how do you maintain a good work-life balance? It's just another way of asking, what do you do in your free time? So you need to be able to talk about your hobbies and things that you're passionate about outside of academics, because they want to see that you would be able to maintain a good work-life balance when you come into medicine, because it is a stressful degree and in the future it's a stressful career and you need ways to be able to de-stress. So they want to see if you have those already in place. And you can also say, I've also researched the medical school and the uni itself, and I've seen that you've got all of these clubs. Pick one or two clubs out, and then you can say, these are the clubs that I'm interested in joining when I start university to continue maintaining a good work-life balance as well. So that will also show that you research the university, which shows even more why you want to go to that school specifically. Main tips: before your interview, reread your personal statement, because that gives you a lot of hints as to how to answer these questions. And if I move on, structure to answering your questions. So a general structure that I would use for all of your questions that they ask in the interview is addressing the topic directly and discussing key examples. So when they ask you a question like, why do you want to study medicine? You need to give examples. You need to talk about what you've seen in your work experience, which has then further inspired you to pursue a medical career. And then try and think of what qualities of a good doctor did you see in those work experiences that have made you, further want to pursue a medical career. And then relate this to why these skills are important for medicine. And then you can finally link back to how you have these skills and why this would make you a good doctor as well. So that's the general structure I'd follow for every single question they give. What type of questions they may ask for reapplicants? The same questions. It's not any different to anyone else. Is it okay to repeat what you've mentioned in your personal statement in interview and answering questions? Yes. But just don't make it sound very robotic. Make it, sound like you're having a conversation with the person, not like you've memorized your answers, because they don't like that at all. Okay, why do you wish to study medicine? So how would you actually answer this question? So you can break it down into four different elements. The first bit you need to address is what sort of sparked your interest in medicine. Was it that you like the sciences? Was it that you've had a personal family experience with doctors or nurses? Did you have a unique experience where you yourself were in hospital and you really liked the way the team worked? Or are there any specific medical topics that you're really interested in, which made you then want to pursue a medical career because you thought this would be the right fit for you? And then how did you explore that interest? that would have been through your work experience and your volunteering. So you need to talk about specific work experiences and volunteering experiences. And then from that, you need to say, how did these experiences confirm you wanted to pursue medicine? And then you need to summarize what you've said in these 3 blocks. And that's basically, if you think about it, your first paragraph of your personal statement. So that's why I say, like, make sure you have a read of your personal statement. Is it bad to go and ah when answering questions? Yeah, so I do it all the time, like I'm doing throughout this whole talk. It's hard not to say and ah when you're used to doing that in normal conversation, and it's even harder when you're under like timed conditions, I think. So try your best not to do it, and the way to do it is sort of plan your answer, take 1 minute after they've asked you the question to just structure everything in your head, and that will try and reduce you from reduce you saying and ah. And I think that's the best way to go through it. And the more you practice with different family members, the more confident you'll feel answering these questions. Yeah, so Manya said to try mouthing instead of saying it, it helps as well. Yeah, it's always good to just take a pause if you're not sure what to say next. And I think that's a better way than saying and ah. But if you do say it 1 or 2 times, it's not the end of the world. They're not going to mark you down for that. Okay, so the next question, why do you want to study at whatever medical school you're applying to? The way to sort of split that is what aspects of the medical school do you like? So talk about the course structure. Do they use PBL or CBL? So does everyone know what that means? So PBL is like problem-based learning. CBL is case-based learning. They're basically sort of the same thing. And it's where you get given topics about, you know, a certain disease or a certain you get given something about a certain patient, like a case, and then you have to discuss it as a group of 6 to 8 people and come up with topics that you don't really understand. You go away, research that, come back and sort of teach each other, rather than doing it just sitting in a lecture theatre with 120 people and just being talked at. With PBL and CBL, it's more active learning because you're going out and finding things out for yourself. So that's the difference between them. Traditional is just sitting in a lecture theatre and listening to the lecturers talk to you. So what structure do they use for their teaching? How do they teach anatomy? So do they do prosection or dissection? So prosection is all the specimens are prepared for you and you just go and learn from them. Or do you actually want to be hands-on and do you want to dissect yourself? So it varies. So some unis do prosection, some unis do dissection. There are pros and cons to both. So have a read of that and decide which one would suit your learning style best. Then clinical placement. So which year do clinical placements start? Do you never ever see any patients until 3rd year? Or do you see patients from 1st year? So you need to decide which would suit your learning style better. For me, it was definitely having early clinical placement, which is why I applied to all universities which had clinical placement from 1st year. And Bristol was one of them. So from the 1st week onwards, you're in GP and you're in hospital every Thursdays. So that was something I really liked because I wanted to have that patient contact from 1st year. Whereas some more traditional medical schools don't have hospital placements until 3rd year. So it varies. And then intercalation. Do you want to go to a university where intercalation is compulsory, or do you want to go to a university where you have the option of whether you want to intercalate or not? So that's something to consider as well, because that varies how long you spend your time in uni. If you're doing an intercalation, it will be a 6-year course. If you're not doing an intercalation and if you think research isn't for you, you should apply to a uni which is just 5 years, and you have the option of taking up intercalation later on. So think about those things as well. And the next bit, why would these aspects suit your learning style? So all these aspects that you've talked about here. So what type of learner are you? Are you more of a visual learner, in which case you might prefer prosection, so just looking at them? Or if you're more of a kinesthetic learner where you like doing things with your own hands, you might prefer dissection, for example. And then the last bit to consider is, what does the university have to offer outside of your course, and how are you going to get involved with that and, you know, make use of the full university experience? So what clubs do they have that you might be interested in joining? Is that like a tennis club or a music club that you might be interested in joining because they fit in with your current hobbies? Or is there something that you want to try new, like climbing? There's like a climbing group or mountaineering group that you want to try out, or there's skiing club and things like that, or sailing club. Is it a skill that you haven't learned but you would like to learn at university? So think about those things, and how will joining these clubs and learning these out extracurricular skills make sure you have a good work-life balance. So make sure to answer that part of the question as well. The next question, actually, before I move on to this, because there are quite a few questions. Is it bad if we take a while to answer? No, I would say maximum 40 to 50 seconds. Just take a pause, think about how you want to structure your answer, and then answer the question. They will not mark you down for that. Which universities did I apply to? Bristol, Cardiff, King's and St George's. They were my 4 medicine universities. So I did 2 London and 2 outside of London unis. And then my 5th one was Queen Mary's, and I applied for chemistry because obviously you can only do 4 medical unis. Do you get time to plan and write down points after they ask you a question? I don't think you have time to write down points because you don't get a piece of paper or anything, but you can just plan it in your head. You do get 1 minute reading time if you're doing MMIs. Could I say that I like the fact that everyone's required to intercalate so the entire year finish their degree together, or is that a bit random? It's not the best answer. I would most likely, if you think of intercalating, I would mostly talk about the skills you gain from intercalation, like the research skills and things like that, which you don't really learn in medicine. You learn a lot of lab skills, you learn how to do research, how to do statistics and things like that, which are things they don't really focus on medicine, but they do help you understand the research side of medicine a bit better. So if that's something you want to gain, you can use that as your answer. Also, roughly how many questions would they ask you? Well, if it's 7 to 10 stations, it would be 7 to 10 questions in MMIs, and in a panel, it's probably around 10 to 12 questions. How formal do you have to be? Quite formal. Think of it as like a job interview. What is intercalation? It is when you take a year outside of medicine between 3rd and 4th year, or 2nd and 3rd year, depending on which university you go to, and you do an extra degree, which is like a bachelor's degree or a master's degree, and you basically do it in a medical based topic that you're interested in. So I did mine in endocrinology, which is everything to do with hormones basically and the hormonal system. So things like diabetes, or like tumors which release hormones, things like that, and that's what I did it on. Some other people did it on cancer, some other people did it on different blood cells, so hematology. Some people did it on cardiovascular sciences. So you can do a variety of different things, and it's a 1-year degree, so you come out of medicine with 2 degrees if you do an intercalation as well, but it's not for everyone. Can you bring your own paper to write notes? I'm not too sure. I don't think I was allowed to at any of my interviews, but I think it's worth emailing and asking. I'm going to stop answering questions. I'll answer them at the end. So how do you maintain a good work-life balance? So what they're trying to ask here is like, what do you do to relax? So talk about your hobbies, and then how do those hobbies help you prevent stress from A-levels? Or, if you're on your gap year, how did they prevent you from being stressed out, if you have a part-time job or something like that. So common current affairs they could ask you about: COVID-19 and mental health. So mental health, COVID had a massive impact on people's mental health in both directions. It had a positive impact for some, but it also had a negative impact for other people. So people who are quite social and things like that, their mental health kind of dropped, especially with isolation and things like that, not being able to see their family, especially elderly people in care homes who we weren't allowed to see. Their mental health declined a lot. And then another thing to discuss that they might ask you about is vaccination and anti-vaxxers. You can talk about why anti-vaxxers have become sort of a huge issue, and that is related to a massive scandal where one of the doctors quite old now, in the 1980s or something like that, said that MMI was linked to autism, but he had basically falsified his results to make this link, so it wasn't actually true. But because he was a doctor, a lot of people believed him. And as a result, a lot of people are against vaccination. That has had an impact even now. where parents refuse to vaccinate their children. So have a read about the MMI autism scandal, because they might ask you about it, and they might ask you about vaccination in general, how vaccines work, why we vaccinate people, and that's obviously to achieve herd immunity and things like that. So they might ask you about that. They might ask you about why antibiotic prescription and antibiotic resistance is such a huge issue at the moment, and why are we prescribing too many antibiotics. So have a look at that. Brexit, so how has Brexit impacted the NHS? The A&E and GP crisis at the moment, which is also probably worsened during COVID. Abortion, as I mentioned before, is a hot topic. Organ donation, opt-in versus opt-out. So if you guys are applying for Welsh universities, you need to look at their specific NHS Wales rules as well, because they have an opt-out system. I think we're moving towards an opt-out system as well. So have a look at what organ donation systems we have in place, depending, because Scotland, Wales, England, slightly different with their NHS rules. So make sure you read up on the right ones before your interviews, depending on where you're applying. And the aging population has been an issue for years. So how is that impacting the NHS? It is causing a huge burden on the NHS, because we have a massive population of the elderly who are living for longer, but they're also living for longer with a lot of diseases, which means that they're on a lot of medication. And if they come into hospital with one thing, everything else goes wrong as well for them, which means that they're staying in hospital for longer, which then means that there's not enough beds for other people to come in if they need to be admitted. And that's then impacting A&E services as well, because we're not able to see enough people in time, and we're not able to move those people from A&E to the right wards that they need to go to. So have a read of all those hot topics. If you just search it on the internet, loads of stuff will come up on all of that. In terms of common ethical dilemmas, so the things they could ask you about is abortion, so pro-life versus pro-choice. They could ask you about euthanasia and assisted dying. They could ask you about giving contraceptives to someone who's underage. So how would you do that? And that's where something called Gillick competence or Fraser competence comes into place, and you might have to discuss that as part of your ethical answer. We will go through these sorts of scenarios in more depth in future 6-month surgeries. This is just a whistle-stop tour of what you could expect from medical interviews, which is why I'm going over them in sort of glossing over them now, and then I'll go into more depth in future weeks. Organ donation, so who would you give an organ to? So they might give you a healthy young person, and then might give you a slightly older person who has been an alcoholic. So who would you give a liver transplant to, for example? And then you have to decide. And then Jehovah's Witnesses and blood transfusions, as I mentioned earlier. So framework for ethical questions is to look at the 4 pillars. Some of you, this might have been the first time you've ever heard of this. So looking at autonomy, beneficence, non-maleficence, and justice. We'll go through that in more depth in future sessions, but basically autonomy is acting in the patient's best interests, or allowing them to be, have the right to make decisions about their own treatment. Beneficence is doing good for patients, and non-maleficence is not doing any harm to patients. And justice is making sure that, things that you do for patients are fair and equal. Because that basically fits in with the values of the NHS, like providing services to everyone fairly and equally. Confidentiality is another common ethical scenario that they might ask you about. So you might be asked about which situations can you break confidentiality in. And you might be asked about informed consent and capacity. So that's where Fraser and Gillick competence comes into play. So just a little bit about the structure of the NHS, because this is good knowledge to have. It was founded in 1948 by Aneurin Bevan, and he basically, at that time in the government, he wanted to offer free medical service for everyone, and since then that's been kept the same until now. So we have lots of different sort of people within the NHS, and then where the money goes to as well. So you've got Department of Health, and they contribute money to the NHS England, which then goes into all the services that we offer for our patients. But some of the money also goes into clinical commissioning groups. So some of you may not have heard who clinical commissioning groups are. So what CCGs do, they are, say, for example, in your local area, you have 2 to 3 GP services. All those GP services once a month, they get together. So different GP groups get together within an area and they look at the statistics of what the most common conditions are within your area. And then they decide where money needs to go to. So if in your area you have a lot of heart problems with your patients, you might decide to contribute more of the money, the funding that you have, towards services related to those heart problems for those patients. So you're treating that specific group because that's the majority of the patients that you're dealing with. So that's what clinical commissioning groups do. They're also in charge of like how much money goes into vaccinations annually, how much money goes into mental health facilities, things like that. So it's probably a good thing to have a look at this figure in more detail. You can have a look at it in the recording later on as well. So as I said before, there's two different groups. People get easily mixed up with both. So Care Quality Commission, CQC, they're an independent organisation and they're basically regulators, healthcare regulators for England. So they're the ones who, they're similar to like Ofsted for schools, basically. So they come into different hospitals and different GPs and they assess whether your service is good enough. And they're basically checking to see that there's nothing bad going on in these hospitals and treatment is good, basically. CCGs, on the other hand, they're these groups of GP practices who meet to improve healthcare that they deliver to their local communities, as I just mentioned. One thing they might ask you about is the postcode lottery. So some areas in GP practice are much more affluent than other areas, as in they have slightly more funding, or they might be, in a middle class, upper class area where they have better healthcare just because of where they are. So obviously that's postcode lottery, because depending on where you live, you're either getting better service or worse service compared to some other area. So that's a bad thing, obviously, because that goes against justice, one of the 4 ethical pillars, because we're not giving equal service to everyone. So that might come up as an ethical scenario. So just to summarize, your medical school interview is your interview to be a doctor, as I mentioned. So do take it seriously. It is an official interview, like a job interview, basically. Make sure you read widely on all the topics that I've touched on today and be prepared for like common questions that they could ask you about. And make sure that you keep calm for the questions that are a bit weird and wacky, and we'll go through those questions in later sessions. So before I go on to this slide, I just want to, because there's quite a few questions, let me just see. Right, you said you previously applied for St George's and King's. I just applied for the same 2 unis. Do you have any interview tips for them? St George's usually always has role play and they have a few weird questions in there. So make sure you practice your communication skills with other people. Make sure you practice role play because it is a bit weird to do if you've never done it before. In King's, they do ask you a lot of research-based questions. So, and King's do a lot of research, like medical research. So if you go into their medical school website, you will be able to see what their most up-to-date research is and talk about that in your interview to just show your interest. What did you do for A-levels and did you do an EPQ? Is an EPQ even necessary for medicine? So second part of that question, is an EPQ even necessary for medicine? No. To be honest, they don't really look at your EPQ at all unless you bring it up in an interview and you say, oh, I did it on a topic which was, COVID or something that, adds to your interview. They don't care if you've done it or not. It's not really that relevant. What did you do for A-levels? So I did biology, chemistry, English literature, and an EPQ. I did my EPQ on something completely non-medical related. I did it on music because, that's one of my hobbies and I wanted to do it on something fun. And that actually sort of helped with my interview because it brought up the topic of my hobbies, which they really liked. So yeah, you don't have to do an EPQ just because you want to show them that, you're interested in medicine and do it on a medical related topic. You can just do it on anything you're interested in and then talk about that as part of your hobbies or something like that. You could just say I did it because it interested in me and it's something that I play the piano, which is my hobby, on the side. So I wanted to find out more about XYZ. So it doesn't have to be medical related EPQ either. The reason why I did English is because I just enjoy that subject and I didn't want to do maths because I knew I just wouldn't like it. With A-levels, I would always pick ones which you like and not ones which are needed, because I knew biology and chemistry were needed and I was happy doing them. Didn't necessarily need maths. So I just thought the third subject, I'd do something that I really enjoy, and that worked out best for me. So yeah, you don't have to do maths if you don't want to. I'm really interested in intercalating, but didn't do an EPQ as my sixth form only offered it in year 13. Would this put me at a disadvantage? No. When you're applying for intercalations, you do another application, and they don't really care if you've done an EPQ or not. The main thing I talked about in my intercalation personal statement was why I was interested in endocrinology, and I talked about my experiences with patients in third year of medicine, which then inspired me to do endocrinology as an intercalation. So you wouldn't really be talking about your EPQ when you're in your third year of medicine. Specific question, I'm a grad applying for undergraduate medicine instead of GEM. After my degree, I worked as a quant. I'm not too sure what that means, in a city on a trading floor, as well as evenings as a career and an NHS healthcare associate. Okay. I haven't mentioned anything in my personal statement about my city job, as I was worried it would reflect badly and it would simply allow me to save up to pay fully for my undergraduate in medicine. Is it worth mentioning now as the stage? You can mention it in your interview. You can talk about the NHS healthcare associate thing and say how that sort of informed you on NHS values, or like if you've seen any patients, stuff like that. If it's not included in my PS or UCAS employment history, work under pressure, you can still talk about it, because it still does teach you lots of transferable skills, so it's fine, you can talk about it. Any tips for Cardiff interview? They do test a lot of stats and math stuff. I had one station where they gave us a lot of mathematical problems. We had to do it under 2 minutes, and that was basically one of the stations. So just practice your maths a little bit, because that threw me off a bit. They do ask weird questions as well. So they asked me a question like, by 2050, there's going to be an increase in the number of flights. How is this going to impact the NHS? So weird questions like that. And all they want to see is if you can show your thought processes step by step. Do you know anything specific to Leicester interviews? Not necessarily. I think it might be worth, because I didn't apply to Leicester and I'm not sure, I can't remember if any of my friends did, and I'm not too familiar with their interview process, but I would check their interview website. Any tips for A-level chemistry? It's awful. It is difficult. I think chemistry was the one I found the hardest. I did do AS physics as well, but then I dropped it because I found it very difficult, and I didn't want to do 5 subjects for A-level. A-level chemistry is difficult, but I think especially with your organic chemistry and stuff, make sure if you go wrong in it, really try and understand what made you go wrong, because it's very easy to like put the wrong formula in and then get the whole answer wrong, and then you've lost like 6 marks. So I think it's just focusing on what you've done wrong and trying and going over those questions again. It depends what your strong point is. Mine, I preferred organic to the normal chemistry, so mine was slightly different. So I think it's just working to your strengths, maybe speaking to your teachers about like asking for extra questions to do and things like that to try and maximize your marks. Would you say then that the EPQ is worth the UCAS points because it takes up a lot of time which could be spent for your A levels? It depends on you. Unless you're really, really passionate about a topic which you feel you would be able to balance alongside your A levels, I would not do an EPQ. I'd only do an EPQ if you find it easy to do essay writing, and if you're really enjoying the topic that you're talking about. Other than that, there's no point doing it. You might as well just focus on your A levels. That's my view on it. I'm applying to Leeds, Kent, Aston, Imperial College. Do you have any tips? Just the main things I said already, I think. And with Imperial, they do, obviously you will have done the BMAT. They do use your third section, your essay section, and they ask you questions based on that. So just try and remember what you wrote for that essay bit for your section 3 of your BMAT, so that you're able to answer those questions, because they might bring it up in your interview. What grades did you get for your A levels? So I got 3 A stars and an A. So I got an A star in biology, English and my APQ, and I got an A in my chemistry. I didn't decide to pursue medicine as a career until halfway through year 12. I've done everything needed, work experience, and I got a good UCAT. Would this put me at a disadvantage? No. I decided I wanted to do medicine in early year 12. So compared to other people in my year, it was quite late because they all knew since GCSEs and I didn't. It's not going to put you at a disadvantage at all. How was the King's interview and when did you do yours? I think it was January or something like that. It was okay. It was very, very similar to the Bristol interview, I'd say. And I sort of give the same tips that I give everywhere else. If you've done badly in a station, just forget about it and move on. Because I think that's something I found difficult to do, because it's easy to constantly think about how you could have answered that station differently, but you need to switch off and move on to the next station. Otherwise, it does really affect your scores. Are certain hobbies given preference over others? Does it have little influence? It's not given preference over others. It doesn't matter what you do as long as you enjoy doing it and as long as it de-stresses you. I'm in year 12, just thinking about how much I have to do between now and medical school. How do you keep motivated when the number of tasks keep piling up, like UCAT work experience? Okay, yeah, it's difficult. I'm not going to say it's not, but having sort of an overall to-do list for the year and just slowly ticking them off will make you feel a little bit better as well. It works for me, might not work for you, something else might work for you, but this is what worked for me. Like having a to-do list for the year and like slowly ticking it off and seeing things get done does make you feel less overwhelmed. And I think you need to take it step by step. If you're just in year 12 now, thinking about UCAT I think is a little bit premature. So don't think about that. Just think about your, settling into A level and trying and understanding the subjects as much as you can and doing a bit of work experience. I would say at the end of year 12 in your summer, so June, July, August is when I'd start thinking about UCAT. So don't put too much pressure on yourself is what I'd say. Maybe your work experience, you can do it in your October half term or your Easter half term, but I wouldn't put too much pressure on yourself. That's all I'd have to say for that. How do you prefer for online asynchronous sections for Imperial? So I'm not too sure because I haven't come across that before. If I think it's just, I'd say prepare for it the same way you'd prepare for normal interviews. And I guess it depends on the task that you get. So just prepare like you would for any other interview. Any tips for Brighton? I'm not too sure what specific stuff they do, but again, just same sort of tips as what I've gone through today. Could they ask questions based on teacher reference? No, they usually don't. So I wouldn't worry too much about it. Do you have any advice for UCL or Exeter interviews? UCL, again, same as Imperial, they bring up the section 3 of your BMAT essay. So just remember the main points that you discussed there. Exeter, I'm not too sure, so check their website. In an interview, can you talk about skills gained from A-level you dropped or didn't do the exam for? You could do, but I would just stick to the ones that you are doing rather than the ones that you dropped. Does deciding on medicine in the middle of year 12 make us look like we aren't really that interested in medicine? No, not at all. Does gaming count as a hobby? Yes. I've had this question before. I did one-to-one person statement tutoring for someone, and he was really worried about putting gaming as one of his hobbies because he thought that, it wouldn't be taken seriously. I think it's a really great hobby to have. So, using teamwork, communication skills. It's also manual dexterity, using the I don't know what you call it. I don't game, but like using the controls and a controller and everything. So I'd say yes, put it in, talk about it in your personal statement and talk about it in the interview, and it just shows that you have something outside of medicine, you're interested in something else other than academics, and you know how to de-stress. It's absolutely fine to use. Can you please give me advice for University of Dundee or Plymouth interview? Right, I'm not too sure about either of them. I know they're both MMIs, so I would just say the same advice as what I've given in this PowerPoint. Make sure you just read up on your current NHS topics. How did you prepare for your interview? Did you buy an online interview course, have a tutor, or just practice random questions online? So I went to one interview course, which was not a 6med one, it was a CAPLAN interview course, which was in person, and that was really good. I don't know how they've changed. It's been, since 2018, so 4 years ago now, so I don't know how they do their interview courses now, but that's the one I attended in November time. And then The only other thing I did was I didn't like practicing with family, which is fair enough if you're quite an introverted person like me. I instead just used to record on my computer me answering the questions. And that was quite helpful for me because I was able to see my body language, and I was also able to see how I structured my answers, because I would replay them and be able to see how I structured it. And then I would try and restructure it to make it sound a bit better. And then I think the final week I did practice with family members and one of the teachers at school as well. So that's how I prepared. Do you have any insight on Imperial? Being an intercalation student there, I haven't studied medicine in Imperial. I've only studied an intercalated degree there. It is really, really good university. And if you are interested in, getting your foot into research and things like that, that's the place to go. Did you ever think you'd be a medical student, say like 10 years ago? No, I didn't. So yeah, I think it is a bit surreal, and you guys will all get there as well. It's just, it seems like there's a lot of things to do and it seems like it's overwhelming, but you will get there. Just take it one step at a time and you'll be fine. What's the difference between euthanasia and assisted dying? Good question. So euthanasia is sort of interrelated, I'd say. Euthanasia is sort of helping someone to die. Assisted dying is more palliative care. So assisted dying is, they're at the end of their life. Assisted dying is what is legal in this country. Euthanasia is illegal in this country. Assisted dying is when someone is at the end of their life. So say if they have cancer, which is spread everywhere around their body, it's giving them only support for their symptoms, because we know they're going to die. They know they're going to die as well, and they don't want any interventions done. They don't want us to treat them. They just want us to control their symptoms, like their pain, their vomiting, their nausea, things like that. So we just give them pain medication. We just give them anti-sickness medication. We just control the symptoms that come up. We're not giving medication to treat their condition completely, because we know it won't be treated because it's spread everywhere and they're terminal, but we're just controlling their symptoms and making it as peaceful for them before their death. That's what assisted dying is. Euthanasia is giving a drug which will cause them to pass away. And that's done, obviously, you might have heard about Dignitas and stuff like that. And that's, euthanasia is illegal in this country. That's the difference between those two. I got a UCAT of 2920, band 1, hence applied to just unis that have a high cutoff. Stuff you mentioned about whether the uni's PBL had an intercalation year wasn't a factor. Will that be a problem if I have to answer? No, just research the universities and see whether whether you like it or not and things like that, and talk about what they offer. So that'll be fine. Any recommendation for podcast, journals, websites to use for current affairs? Websites, you've got the SixMed website, there's Medic Portal, which has got lots of stuff about current NHS topics. Podcasts, I'm not too sure. There might be some on Spotify, I'm not too sure. But the main ones I used was Medic Portal and SixMed, so try those. But you might find something on Spotify yourself as well. I get extra time in tests, so I'm a bit worried about stuff under time pressure. When doing reading for stations or MMI, where you do maths problems, is it rushed or do you get enough time to do it? I found it slightly rushed because I didn't expect to be doing like UCAT style quantitative reasoning questions in an interview. I didn't really do that well in that station anyway, but remember, it's just one station out of loads of them, so it might even out your marks. Yeah, it is hard, obviously, because if you get extra time normally and in MMIs you tend not to get extra time, it is difficult, but just try your best to answer as many questions as you can if there is a written one like that. Is assisted dying the same as assisted suicide? No, so assisted suicide is another word for euthanasia. Assisted dying is what I mentioned just now. What did you study at Imperial during intercalation? Medical sciences with endocrinology. That was my degree. What's the difference between foundation year degree for medicine and normal 5 years? So foundation year degree is you start with year 0, which is basically a year to get you up to speed of what a first year medical student, of what people joining first year would know. So they would cover things like, chemistry, biology, that kind of stuff. And then you do year 1, 2, 3, 4, and 5. So you'll be there for 6 years, just like a person who intercalates would. So you would start in year 0 and then move to year 1. Which unis look heavily on high GCSEs? Cardiff does. They give you points based on how many A stars you've got, or how many 9s you've got, or 8s you've got, and things like that. And then they decide whether they'll invite you for an interview or not. How much time do you have between invitation and actual interview? Varies between unis. In Bristol, they invited me in the first week of November, and my interview was in the 3rd week. So I had about 1.5 weeks to prepare. For Cardiff, I got invited in November, but I had the choice of choosing a date in December. And because I didn't want to do my Bristol and my Cardiff interview in the same week, I decided to do Bristol first and then Cardiff in December. So yeah, sometimes they'll give you a choice of dates, and they might be in like, a bit further away, like in December or January, but it depends on the uni. What kind of maths questions come up in interviews? Similar to your quantitative reasoning section in UCAT. Those are the kinds of questions that come up. Or they might ask you to work out volume of a drug, stuff like that, and you do simple conversions. So Alex has given some podcasts, which is really good. Yeah, New England Journal of Medicine is good as well. There's also BMJ student podcast on Spotify, which I just remembered. How often does DNR form come up? It can come up in ethical scenarios. So for people who don't know what DNR means, it's do not resuscitate or do not attempt CPR on a patient. And it can come up. That might be one of the ethical topics that comes up. So it might be worth reading up on that as well. So that's all the questions in there. There are a few Q&A questions. Did you get into all your unis? No. I got into 2 of them. I got into Bristol and Cardiff, and then I chose Bristol. They are difficult. The London unis are a bit more difficult to get into, I'd say, because so many people apply. What ways can you impress the interviewers? Just be yourself and make sure that you talk about your work experience a lot, so they understand that you've made an informed decision to study medicine. I've answered that question. In ethical scenarios, do they look for problem solving skills? Yes. So make sure you talk about the pros and the cons. Look at both sides of the argument in ethical scenarios before coming to your answer. Should I purchase an interview course? Up to you. What you want to do. It depends on, with interview courses, it's good because they go through, they basically make you do a massive mock interview throughout the day. So you'll get a proper idea of what an actual medical interview is like. So if that's something you're interested in, feel free to do that. What challenging topics come up in MMI? Role play is the one I find the most difficult because it's an artificial scenario. Those patients who are doing the role play, the actors, they could cry, or it depends on the scenario, and it's something that you need to be able to learn to deal with. And I think the more practice you do, the easier it gets. What is intercalation? I've answered that one, and the next one as well. In intercalation, do you come up with your own question and then research it, or is it fixed? That depends on the university you intercalate in. In Imperial, they have a list of different projects, and you get given a project based on how well you did in your coursework over the winter term. So if you scored really highly, you get your project of choice. If you don't score as highly as someone else, and you want a certain project, but there's a few other people also wanting the same project, they'll look at who got the best grades and then offer it based on that. But I don't know how other universities work. Are these questions similar in a dental interview? Yeah, they are. Do Scotland and Ireland have different organ donation systems? Not too sure. I know Wales does. I don't know about Scotland and Ireland, so it'd be worth looking into it. What's the difference between, done that question. It says the diagram is based on 2010 figures. Should we use these figures in our interviews? Yeah, I would say look at an updated version. I just picked it out because I wanted to talk about a clinical commissioning group specifically, but see if there's an updated version. For Imperial, Leeds, Aston and Kent and Medway, do you have any tips? Oh, I think I answered that one. Any tips for Cardiff interviews? They have 10 stations usually. They might have changed it this year. And I think it's very, very similar to Bristol. Bristol and Cardiff, even their medical school, the way it's structured is very similar. So have a look at their website, make sure you know inside and out how the university works, because they have like a spiral curriculum. which is different to other universities. Both Bristol and Cardiff have that, where you learn a topic in year one, you come back to it in second year, and again in third year, fourth year, and fifth year, and you build on what you've learned, because they've determined that's a good way to learn, apparently. And I agree with that. I think Bristol does a really good job of it. I'm applying to Leeds, Kent. Okay, answered that. And that one. How was the transition from A levels to medical school? I'd say A levels were harder than medical school. Because first year of medical school, you actually kind of go over a lot of topics that you've done in biology and then build on the clinical side of things. Whereas in A levels, you've got to learn, a vast variety of things. Like in biology, for example, you have to learn about plant biology and stuff. Obviously, you don't have to do that in medicine. So yeah, it is more difficult in A levels, I thought, than it was medical school. Do you recommend talking about your own medical issues as a motivation for medicine? You can do. I wouldn't just talk about that. I would talk about another thing that sort of motivated you to do medicine as well. Tips about Lancaster Uni, again, same as the other questions which are similar to this. I'm not too sure, so I didn't apply there, but I'd have a look at their website. Does gaming count as hobby? Done that one. Were the King's interview more difficult than others? I found King's a little bit more difficult. I think it was just because of how many research-based questions they asked, as you mentioned, but that might have changed now, because it is 5 years ago. How much time do you have between invitation and action? Done that one. Which medical uni do you go to? Bristol. And any tips for Edinburgh? Probably sort of same stuff I've said here. Again, I don't know much about it. Maybe look at NHS Scotland stuff as well to make sure you're up to date on everything. Which of the 4 pillars is DNAR under? Autonomy, like having the right to do what you want to do, and the doctors respecting that. As I came here from another country, can I talk about healthcare issues which I observed there? Yes, you can. But also compare it to the NHS here. What do you mean by research-based questions? They might ask you about medical research, like what cancer, what's the most important research that's been done in the last 10 years. You could talk about the COVID vaccine, stuff like that. So it will be in the news, it will be on their website as well, because they do a lot of research. And the last few questions before I go. When they're choosing who to give offers to, do they take everything into account? After you've got the interview, they just look at interview. If you and another candidate score the same marks at interview, they will then look at your UCAT score or your personal statement or your GCSEs or your predicted to decide who to give the offer to, because you've basically got the same mark. So it's a case-by-case basis, and it also depends on the uni because they use different mark schemes. Can you intercalate in any abroad unis? I think you can. It depends whether your university has a link with a university abroad. Like I know Queen Mary's have a link to somewhere abroad. I can't remember where it is, but yeah, you'd have to check on the uni website. How's the social life side of uni? Do students have one, or is it always studying? You do have a social life, but you need to learn to manage your time well. And it's very easy to do. It's just making sure that you get all your work done, but also make time for other stuff as well. Yeah, Malta, that's the one for Queen Mary's. Yeah, so just have a look on the website. I'm going to stop there. So that's the end of the presentation, and hopefully you guys found that session a bit useful. Let me stop sharing. So I'll end it there. Go and enjoy the rest of your Sunday, guys, and I'll see you probably next week or whenever the next surgery is. Yeah, no problem at all.